morning from Germany. I'm very glad and happy to talk today and to see that the organizers have chosen such an important topic, and I will give an overview on the impact of the global climate change crisis on infectious diseases. And you'll see the pictures above on the left side. I'm talking now in Freiburg in Germany, which is in the Black Forest. That's really a beautiful area. But we see now pictures like that one on the right side. So I'll come back to that picture, and we'll see how infectious diseases come into that field. To start with, these are my conflicts of interest, which should not be relevant in the content and the topic today. So I would like to talk about the consequences of climate change, and these are that's relevant in several directions, and we will specifically focus on vector-borne diseases. I will try to give you a European perspective, but also to come in with some recent US data or updates in this topic. And we'll also talk about the impact on other infections which are not vector-borne diseases in the stricter sense. So for all of you who want to get a broad overview, I can really recommend this work. It is the Lancet Countdown on Health and Climate Change, entitled Code Red for a Healthy Future. And basically, this is an overview on how diverse and massive the consequences are of climate change. And before we come to infectious diseases, I just would like to point out that there are also heat-related deaths we are facing. And in the graph you see, so this is the US and Germany as one of the countries that are most affected by this. We see extreme and exceptional droughts. This is on the left side in a frequency we did not know before. So this is really apparent, I guess, in almost every region of the world. The numbers of wildfires are really going up, and from every continent we hear the reports. And we see, and the report points out to that, that there are enormous consequential costs of climate change, in terms of agriculture, in terms of manufacturing and construction. And the important point is there is a perfidious imbalance in terms that the countries that probably contribute most to the effects which cause the climate change, they are much less affected by the consequences as the low-income countries, where a lot of labor is lost and where the coping with the consequences is much more difficult. So this is the broader stage. But again, before coming to the infectious diseases, I would like to point out that the climate change we are talking about is not the only one which affects infectious diseases today. There are a lot of other changes going on. There is expansion of the urban area, so the crossing border between urban and wildlife areas are blurring in that sense. There are poor sanitation and high population densities going along with urbanization. So there is a lot of transmission we've seen in COVID, you all know for sure. There is huge global transit networks are running. This is an unprecedented communication and frequency we did not know 50 or 100 years ago. And this all contributes to infectious disease epidemiology. And obviously, and we're going to talk, this will be a major part of the talk, is that vectors are profoundly influenced by the climate change, by global warming. So there is enormous vector dynamics, and this comes along with major consequences. There is very good work done by this group that try to model different climatic hazards. You see them on the left side. So this is warming, global warming. These are changes in precipitation, floods, drought, storms, all these climate hazards and their impact on transmission dynamics. So, and the most prominent ones are vector-borne diseases, waterborne, airborne diseases, foodborne diseases. And if you model these changes, then you will come out that about 58% of infectious diseases will be aggravated by climate change. So that's the broad overview. And I will try within the next minutes to highlight some of the major infectious diseases we are facing in Europe, and maybe some of the newer ones or renowned older ones you'll face again in the US. So the first one in terms of numbers and is dengue fever, and you're probably all familiar. Millions of infections per year, most prominent in Southeast Asia. The 4 serotypes of the disease. It's a classical fever, arthralgia, rash syndrome, and there are complications as dengue hemorrhagic fever in some patients, and the vectors are Aedes aegypti, the left mosquito on the left side, and Aedes albopictus. And this is maybe the most prominent example and change, the Aedes albopictus epidemiology, which you can see on the lower side, pointing out to areas where Aedes albopictus is residing now. And this major change I would like to demonstrate. When I started working in this region 17 years ago, so these were the first reports. So in 2010, this was the first report on a first case of autochthonous dengue fever in France. From bad dream to reality was the title of this case report. And when I started here in Freiburg, there was this report coming out and basically describing for the first time Aedes albopictus in Germany, in southern Germany, in our region. And you see here, this is going along the railway and the large routes, the highways. So, and obviously these vectors, they can't cross the Alps by themselves, so they travel along with the railway or trucks, and then they go out of their transport system. And now I'm here, Stühlinger, that's the university hospital, and right beside there is a train station, and probably those mosquitoes came along with the trains and resided here in the garden and cemetery, and those developed breeding sites. And this was worth a report in Eurosurveillance at that time. And now we look at it 10 years later, and that's the ECDC always publishes every year a card about the distribution of Aedes albopictus. And you'll see here that there are, in all the red regions, the Aedes albopictus is established on a regular base. And this is southern Germany here, the red side in the middle. So the mosquito is here, and with that, the principal prerequisite for transmission, if a viremic patient is returning from a country, is given, and so there are about more than 20 viral diseases which can be transmitted by Aedes albopictus, and this is I think at least in Europe, the most prominent example what happens here. And if you then look, we had the first case in 2010. Now, these are the European Centers for Disease Control do surveillance. There was a first case now in Spain also. And if we take a look, so these were the numbers. So in 22, France has reported 9 outbreaks with a total of 63 acquired cases. In 23 cases, mainly in Italy, France, and Spain. And these are not large numbers, but the most important thing is the dynamic here. So the change we witness within these 10 to 12 years, and this dynamic will go on. And this comes back to the vectors and to invasive species. So we know vectors, Culex and Anopheles. These have been here all the time. But Aedes aegypti and Aedes albopictus, they have the potential to go into new areas and then to broaden the area of transmission of these major diseases. So dengue would be the first example. The second one is chikungunya, which means bent over in pain. Again, this is a viral disease of an alpha virus. The clinical picture is very similar. So it's fever, arthralgia, and rash. The disease is famous for causing persistent arthritis of the small joints. And again, this has been a new entity in the Mediterranean basin. So this started in Italy 2007 with the first outbreak, and now there are outbreaks in France and Italy recurrently described. Next example, Zika. You all know Zika probably. There has been this outbreak in 2015 in South America. And this is the Zika transmission card from 2017, 2018. So you see there's a white spot in Europe. But again, this has changed in between. So in 2019, there's the first case of autochthonous acquisition of Zika virus in southern France, again going along with Aedes albopictus. These are diseases which have this is a specific disease going along with complications, Guillain-Barré syndrome, and also with fetal malformations. So again, it's fever, arthralgia, rash, but the complications are fetal malformations, which have been prominent in Brazil in the outbreak with microcephaly and ocular manifestations. So these are these are diseases we did not know in Europe. So the other entity I can talk about is meningitis encephalitis. And in the US, you know the disease for a longer time. So this is West Nile virus. But again, this is new for us. In Europe, this started around 15 years ago. And in Europe and in Germany, it started 5 years ago with the first human cases. In the US, there are in almost all states, there is a West Nile virus around with some yearly epidemiological ups and downs, but these are the diseases that will stay with us within the next years, and will, depending on the climate dynamic, the numbers will increase. So West Nile, again in Europe, a new entity, and we had, you could say, around 800 to 1,000 cases a year now in Europe. So one of the most famous and oldest disease there is malaria, and malaria. This is an historical picture from 1882 about the malaria endemic states. And it was malaria was officially eradicated in the US in 1951, and there have been some outbreaks 20 years ago. But just in 2023, there were at least what I could find out 10 cases in the US, so 7 cases in Florida, Texas, Maryland, and Arkansas. These were all Plasmodium vivax cases, and they were not interconnected to each other. So again, there is development of vectors. There is coming along with a lot of mobility, and so malaria is coming back in single spots. So that's would we need to keep in mind and keep an eye on it. There are also other vectors which are relevant. So tick-borne diseases, Crimean Congo hemorrhagic fever, quite a nasty disease transmitted by Hyalomas ticks. They are substantially larger than the ticks we usually and North America are prevalent. And this disease there is endemicity in Africa and in Asia, and there have been cases in Turkey a lot, but now first cases in Spain, and this goes along with the other climate conditions, and there is broadening of the tick, and the tick is also now has been described in Germany as a totally new situation for us. So coming to other diseases, coming from vector-borne diseases to other food and waterborne diseases. So there are Vibrio infections. You might have heard of them. So Vibrio are gram-negative rods, and they cause, they used to cause skin and soft tissue infections for, in my clinical practice, those were returning travelers from the tropical and subtropical areas. And Vibrio, these bacteria love the warm and salty marine environment and are there in brackish water. And this is a case we saw in southern Germany 1.5 years ago. Severe skin and soft tissue infection turned out to be a non-toxigenic Vibrio cholera infection acquired in the Baltic Sea. And this was for us totally new. We have never seen that before. But if you go into the recent literature, you'll see that in the areas along the coastal line, there is now experienced that there is heat wave associated Vibrio infections. This was a case series published, and these are mainly wound infections, but also really severe pneumonia, bloodstream infection with relevant mortality, at least in patients with comorbidities. So that's new for us, and so really nasty skin and soft tissue infections. And you see this is a seasonal disease. And you see here that this is an estimation of the area of coastline which is suitable for outbreaks. And you see the first line is the Baltic Sea, and this is going up tremendously. And the ECDC now publishes a real-time prediction model where you can see the proliferation likelihood of Vibrio depending on the temperature we have right now. So that's really remarkable that such things are now necessary and developed here. A last example, this is again from the US. This was reported at the ID Week last year. So Chromobacterium violaceus causing really necrotizing fasciitis and disseminated disease. And the background was in Florida, this patient was the Hurricane Ian, which then brought trauma and exposition to, again, water and soil. And this patient got really severely ill. He survived then with aggressive treatment. But again, these are diseases which come along with the climate change, with the climatic hazards that we are facing in nowadays. So I would like to sum up and give an outlook. So the climate change is a major driver here. There are cofactors like urbanization, increased mobility, and transit networks, and they all have a profound impact on infectious diseases, both in terms of the regional prevalence, but also on the numbers of the diseases. We see really relevant expansion of vectors, particularly of Aedes albopictus, at least in Europe, but this will not be the only example. We all are awaiting that West Nile will also disseminate in Europe to a much more broader area. So arboviroses are the major or the most often caused infections: dengue, chikungunya, Zika, West Nile fever. There are tick-borne diseases, which I haven't alluded on now, Borrelia. So we see cases of Lyme borreliosis, viral encephalitis. We used to see tick activity sometimes between May to, let's say, October, but now with really warmer conditions here, also in the Black Forest, we see cases or ticks coming from March to November. So that is also very new for us. There are other waterborne and foodborne diseases, Vibrio and Chromobacterium, just as some examples. So I think we all have to be aware that there are immense challenges to come. And this is on the one side in terms of the clinical perspective. So the diseases we have to take into account and we have to put on our list on the differential diagnosis. But also we have to think about, we have to draw, I think, major consequences with regard to behavior and lifestyle. And so the manuscript I already mentioned in Nature Climate Change brought this conclusion basically here. The human pathogenic diseases and transmission pathways aggravated by climatic hazards are too numerous for comprehensive societal adaptations. So highlighting the urgent need to work at the source of the problem, which is reducing greenhouse gas emissions. So we have to have a causal approach to the phenomena we see here. So and with that, I would like to end my presentation, and I'm really glad that the topic was chosen, because I think it's a major topic and challenge for us. And I'm happy to take questions now. Thank you very much.